So pulmonary arterial hypertension, it's a condition, it's a disease where the blood vessels in the lung become thicker and narrower, so it's harder for the blood to go through them. So usually the blood goes from the right side of the heart to the lungs. So usually over time, the right side of the heart will get weaker. So it's really important that this is not the same as the blood pressure that we can check in the arm. It's a complete different disease. And if it's not recognized early, it can lead to a lot of serious complications in the heart. The good news is that if we can catch it early, then we have the right treatment, we can significantly improve the outcomes. So the symptoms of pulmonary arterial hypertension sometimes can be subtle at first, and so patients can often notice that they are short of breath, that they're fatigued, that they don't have the same endurance, and sometimes they can think that this is related to aging, being deconditioned, being out of shape, like because of stress, and usually that delay the diagnosis. So what is important is to recognize the symptoms, and a lot of the symptoms can be part of other diseases. So that's why it's important to always bring up any abnormality to your physician. So because the heart and the lung work together, when there's increased pressure in the lung, then the circulation in the right side of the heart becomes much harder. And so eventually, if we don't take care of the pressure inside the lung, the right side of the heart is going to fail. And that's when we're going to start having symptoms of right-sided failure, for example, fluid. And then we have to put a specific medications, not just to help with the pressure, but also to support the right side of the heart. So they work together. So it's really important that we identify the symptoms early so we can start the treatment right away. So when I talk to patients about the options and the treatments, we need to understand that this is a team effort. So I'm going to give recommendations, but I need a partner, and the patient has to be the partner so we can achieve the goals. If the goals are improving the symptoms, slowing the progression of the disease, protecting the heart, and then we can make this a more tailored approach to that specific patient. So I always emphasize that this is a marathon, and so we need to train for a marathon. So we need to go step by step, and then if we work together, we're gonna finish in the right way. So when the patients get diagnosed with pulmonary arterial hypertension, this can be overwhelming, but a lot of the patients need to understand that if you follow the treatment, there's hope to make significant improvement in the quality of life. And we have dedicated team members that can help you through that journey to maintain a good quality of life, to continue to do the things that they like to do. And is about having a good communication with the patient so they can understand and do their part. And it will require a lot of longitudinal follow-up, multiple visits, and usually multiple tests to make sure that they are responding to the therapy. I think it's important to understand that it's a disease that is underdiagnosed. And then when it's diagnosed, it's really important to refer the patients to the right center because it requires a multidisciplinary approach and people who are dedicated to making sure that these patients do well. There are so many therapies available, and sometimes it can be confusing even for physicians to know which one is the right pathway. We usually treat with multiple medicines at the same time, and these medicines are sometimes expensive, and they require a team, not just from the physician component, but also pharmacists and nurses that can help the patient get to the right therapy.